안녕하세요. або здоровенькі були.
Konnichiwa.
Today, in simple terms about biomechanics, after viewing this video, you will know how to stand, walk and sit in the right way. Vitaly will tell you about the basics of beautiful posture and how to determine the difference in leg length. So we will pay attention to the bone references and you will know how to diagnose scoliosis and kyphosis. So let's start.
Chiropractor Vitaly Kazakevich.
Hello, my friend. We are going to do a palpation visual diagnostic to Margot. We are going to do the diagnostic as she stands, so that we can exclude a problem of the legs. We'll have a look if there is any difference between the height of the hip bone depending on the shoulder scapular height. So we are going to start from the front. So, how should we approach this? First of all, we have put the feet together. After that, we are going to take a note on how her feet line up compared to the medial malleus bone on her toes. So, we are looking at the size of the foot. Secondly, what we are going to look at. Close your eyes and put your hands together. We always have to look at the length of the fingers. If you can see, her right hand finger is longer than her left. So, we need to double check. Is the finger longer? Or has she pulled back with her hand? That's why one hand is longer. So we need to check again. Shake your hands, close your eyes, and put your hands together. Again, your finger is slightly longer. Try again. Shake your hands, rotate your shoulders. Maybe somewhere your muscle is tight, in spasm. Put your hands together again. Relax. It's still a little bit longer. Maybe one of her hands is physically longer than the other. To exclude that, we need to put her elbows together and look for results. They are the same level. We also need to check the lengths of all the fingers. So, we've done all this. So we need to take notice on some moments of the functionality of her muscular system. So, now we ask the patient to stand facing us. Let's do it this way, so the camera can see it. Then, I squat down. It is very important to watch the line of the shorts are lined up with the bone on both sides of her hips. We are looking at the level of the shoulder. So we see the shoulder with the clavicle are different heights. Please stand this way for a better view. So we see the left shoulder is higher. There could be three reasons. First, leg length discrepancy. Second, pelvis misalignment. Third, scoliosis. Now I need to check if Margot has scoliosis. She needs to tuck her head in. Now, let's take a look at the spine. From this position, it is very difficult to see if she has scoliosis. It's especially difficult to see it in children and teenagers aged between 12 to 14. Most of the time, parents don't take notice when their children grow taller very quickly. They could be developing scoliosis. Not long ago, a parent brought in a daughter with stage 3 scoliosis. She had a hump on this side. Her mother explained, when she was little, they missed that problem because her bones grew in faster than her muscles. This caused the spine to grow in at an arc, which we call scoliosis. To check properly, we need to ask the teenager to bend down. Try to get her to touch the floor and make sure she keeps bending her head, not backwards. Please turn to the camera. So, we can see that Margot has a perfectly straight spine. Any parents can take 2 fingers and drag down, along their child's spine. This is called a visual palpation diagnostic. Okay, stand up. So, we now know that her uneven shoulder level is caused by either a leg length discrepancy or a pelvis misalignment. The quickest way to find the problem now is to ask the person to walk backwards and forwards. For the best result, we need the patient to keep their eyes so that they cannot close their eyes so that they cannot control how they walk. So you start walking backwards and forwards, and I will be watching. Okay, open your eyes. So what I noticed, please stop. I noticed that your foot falls inwards. There is a longitudinal flat feet. To confirm, I will insert my finger between the arch of her sole. Can you see it? Yes. I noticed as soon as you started walking. The right solution for you is to see an orthopedist, and he'll issue you an insole, specially made for you. Here's what will happen once you start wearing the insoles. It will stop your footfalls moving inwards. Once your leg falls inwards, your knee will soon follow, which will cause even more problems. It will affect the cartilage and ligaments that surround one side of your knee. Of course, you will not notice it when you are 20 years old, but once you hit 40 or 45, it will become a problem. I'm not even mentioning your 50s. The side that is more compromised will wear out quicker. So, the knee joint will be slightly unangled, which will affect the medial, meniscus, and ligaments which cause pain. I've had this in the past. When I was younger, I injured my ankle, tore my ligaments during some sport. The ankle became unstable. After that, I was walking slightly crookedly, and after a while, I felt a pain in my knee. Because I knew it was a problem with the knee, I was trying to buy an insole in my country by visiting all the local shops. It was hard. Every time I bought an insole, it didn't last long, a week or two at most. It was bad quality. But when I found this insole made in Switzerland, it was good quality. Cost me about 100 euros. I used those for 2 years already. Using a good quality insole, my knee pain disappeared after 2 weeks. Later on, I went to see my orthopedist. He checked me and told me I no longer have the longitudinal arch in my foot. I told him about the injury I had when I was 17 years old. That time, I was 44 or 45 when I went to see my doctor. So after so many years, nothing can be done. Because you are still young, it is not too late to sort out your problem. It's very important that you find a good quality insole. Now please stand this way. If this leg falls this way, what will happen to the pelvis? This leg is a support. The floor is your footing. So when your leg slightly falls in, your pelvis drops down. And your shoulders stand on what? Your pelvis. So understand why her left shoulder is higher.